Today, I have an extremely special guest who is one of the pioneers in aesthetics and wellness and all things sexual health. So I've got Dr. Lieman here today, who is a board-certified obstetrician gynecologist and and a member of the American Academy of Aesthetic Medicine. She has been a leader in the industry for over 20 years, starting out in GYN and then pivoting her clinical practice into aesthetics, wellness, and sexual health. In January 2016, Dr. Lieman realized her vision of opening a science-led luxury med spa where she and her staff are highly trained professionals that provide personalized and reassuring approach of aesthetic medicine. She has since grown her practice, and not only that, she is an extremely amazing trainer, expert, mentor, teacher. I've sat in her sessions, and if I'm saying that because I learn a lot, she's amazing. So if you ever have an opportunity to train with Dr. Lieman, you need to take that chance. So, Dr. Lieman, let's start with just how did you pivot from obstetrics gynecology into kind of what you do now? Like, I know why, but I want the audience to hear why.
Well, first of all, I'm blushing because that was the nicest intro I've ever heard in my life. So thank you, Lexi. And I love you right back. My pivot took some time. And it's funny because now that I'm teaching constantly, I always tell people, and you probably can relate to this, is don't have one foot in one thing and one foot in another. Don't do what I did. Learn from my mistakes. It took a long time for me to transition. And I was an OB/GYN. I feel like I can't give it up. I am one. However, I think, probably I started doing some injectables when I needed them, selfishly, and it's very easy to learn and very hard to perfect. And I think everyone can agree with that. I'm a surgeon by training, and sticking a needle in and doing Botox was very quick and easy, but it took a long time to perfect. What I will say, though, is during my transition, I gave up OB first, and then I gave up major surgery for GYN, and I slowly transitioned into 100% aesthetics. What is so fantastic, and I love that we're talking about that today, is that the world of sexual health and wellness became part of the aesthetics industry, and therefore my worlds collided. And now I'm super excited because I feel as though I get to do all the things I did before and love, but I get to do them in a much less stressful environment and a way that I can make people very happy without the risk and sleepless nights. I have 3 children, and I had a lot of sleepless nights feeling bad about being in the hospital instead of being at home. So that's how my worlds collided, and we've been open for 10 years now. I'm opening my brand new second location in April in Topsfield, Massachusetts, and I've had our location in Needham, Massachusetts for 10 years.
One thing I will say about you is that when I see you speak, when I've seen you do consults, when I see you on stage, you can tell you are so passionate about what you do. Like, there's no doubt. And I think so much so now, you've been doing this a while, and I like you, I'm coming from a completely different sector as far as integrative medicine, functional medicine. And so for me also, I resonate in that my worlds collide now too. What I can definitely say about you and why you're different is because the passion that exudes through you in your consults, it's like contagious. Like I walked out of that class with you. I'm like, oh my God, I'm going to go just O-shot everybody. Everyone's getting an O-shot. Everyone's getting a P-shot, because why not? Like it makes no sense to not embark on this thing. And I think you do it in such a way where like everybody's comfortable. Like everybody's taking their pants off, and it's like, okay, this room has like 30 people in it and it's freezing, but like, let's do it, right? And so I think that is one thing that I want listeners, especially if they're practitioners getting into this field, you have to be passionate about it. Don't just do it to do it. Like, if you're going to do it, like, you need to love what you're doing. And I think you are such a great example of just that. Like, you have to love what you're doing, because you're going to have good days and you're going to have some really fucking hard days. And it's like remembering what's your why. Like, that's why you do it. Right. So I think you're just such a good example of that. So obviously, if the listeners can't tell, huge fangirl. Okay. So next section here, let's jump into a little bit of the sexual dysfunction type stuff. So now you treat men and women. I feel like I have this conversation a lot, probably more in my practice with women. So let's talk a little bit about, when do you first start noticing sexual dysfunction? I know, we had I had done an Instagram post the other day about women on oral contraceptive pills and why their libido tanks, right? We talked about sex hormone binding globulin starts to rise, which binds up that testosterone, and then now their libido's in the shitter. So let's talk about that. So you see it when women go on birth control, right? Other things would be breastfeeding, right? We see it then. And then start digging into like kind of like that perimenopause, menopause type stuff.
Yeah, I'd like to go back to, I'll answer your question in a minute, but I'd also like to go back to talking about men when, as a gynecologist, I only ever treated women. So it was a little bit daunting for me, other than the 4 penises that live in my house, to think about treating penises.
Yeah.
And, I'm a doctor. I'm sure I can figure it out, but my passion truly is women. And that's what I've cared for. And it was one of those things that I realized, my patients would come in and they'd say, do you do anything for men? And I said, well, I've been trained to do the P shot. I just don't treat men. And I realized I'm missing out on something, not only business, but also the partners to the patients that I'm treating. And very quickly, the male population grew dramatically. So I would advise anyone that's doing O shots that's a little wary about thinking about the P shot, definitely do it. Those patients need it. You'll get comfortable really quickly. It's very easy. Anatomy is much easier than if you're training yourself for vaginal anatomy. So let's go back to your when does sexual dysfunction happen? Sexual dysfunction, it's very interesting. If you look up the ICD, the definition is it has to interfere with your life for it to be true dysfunction. Well, how is that? Like, is it interfering? Who's going to judge if it's interfering with your life? So yes, the 20-something on birth control, absolutely. How about on antidepressants? Because antidepressants numb everything, not just your anxiety level and give you kind of take the tone of your life down a little bit, but also they numb your orgasmic response. And some of them are like well known to cause anorgasmia. One of them is Prozac. It's like the most dramatic decrease in orgasmic function we see in Prozac. So age, it doesn't have to be menopause. Right? So then as we go into our 20, 30, now Mirena IUDs can cause some issues because of the high progesterone, breastfeeding high progesterone levels. And listen, breastfeeding is enough that you don't really want to have sex. Like, who's horny while you're dealing with your tiny newborn baby, right? So there's a lot of the world dynamic and the life dynamic that's going on there with a new child. But that being said, it can also be that is the cause itself. You're not going to stop breastfeeding, but there's things to enhance your overall reaction. And then as we get into our 30s, 40s, 50s, we're looking at, depending on what's going on, menopause, perimenopause, hormone changes. Again, just not only hormone changes, life changes, cancer treatments. And postmenopause, that's just hell now. Let me just start with that. We can do a whole session about how awful postmenopausal patients are. So dryness, decreased libido, decreased orgasmic function, atrophy, so painful. Who wants to do something that's painful? Just the leakage. We haven't even touched on stress incontinence, urge incontinence. We see that postpartum. We'll see that with a decrease of estrogen, the urethral sphincter changes and therefore can't hold urine when you're jumping, sneezing, coughing. So stress incontinence, and we can get into treatment options, but we can solve all those things.
Right. Yeah, no, absolutely. And I think the other piece of it is like, there's so many tools in the toolbox that I don't think people realize. And many of it, and again, I've heard you speak, it's like, especially if you do aesthetics and you do PRP, you already have some of these tools. Like, it costs you no additional money to do this. You just got to go get trained with someone amazing like you, right? So I think that's super helpful to just kind of lay the groundwork. I think sometimes when I'm having these conversations with my perimenopause, so that's like 35, 40, and I'm like, guys, progesterone's declining. Unfortunately, testosterone peaked at the age of 20 and then dropped between 1% to 3% every year after. Pair that with, not a great lifestyle. They're not sleeping. They're not exercising. They're on the semaglutide. So they're losing muscle. Guess what? When you're losing muscle, you're losing some of that testosterone too. So it's all like a vicious cycle. And so I think, just as you said, a really good kind of comprehensive approach is going to be absolutely ideal. And I've seen you do a consult. And I think really you're going to get most of that information in that consult piece of it, which is so, so important. And then as far as, kind of how would you describe to a patient, like the process of what that looks like as far as a workup? Like, how do you just jump into an O shot? Do you jump into other things? And I'm going to jump in because I do some of the like compounds and the topicals and all those things. So how does that workup look for you in your office?
So when somebody comes in for a sexual wellness consult, because we don't do hormones, I did hormones for 20 years as a gynecologist, and I didn't decide to go through that. I'll just send them to you for that. So that patient, they fill out what we call our sexual wellness survey. And the survey is comprised of multiple questions that kind of ascertain what's going on with them. So first they fill out their survey, but then I ask very guided questions. First of all, their age is going to tell you a lot of what's going on with their ovarian function, right? Their periods, are they regular? Are they not? Are they on birth control? Do they have an IUD? Do they leak? How many children have they had? How were they all vaginal deliveries? How big was the largest delivery? Did they have any scary repairs? Because you can tear straight through, right? That's a 4th degree vaginal tear, and that can cause a lot of problems with incontinence. Did they have any vaginal surgery? Did they have C-sections only? Stress incontinence, how were their labors? You can get a lot of information. Now, most people are coming to you because they just want, they've heard the O shot, they've heard the P shot, they just want the magic. And the most important take home as a provider, if there's providers listening, setting expectations are important in every single solitary thing we do. This is no different. You are not going to make a 50-year-old feel like a 20-year-old. It's impossible. And we can't make their face look like a 20-year-old either. But to improve, I use a grading system of 1 through 5. And if I can make their 5s go to 4, they're going to feel better. They're going to feel better about themselves. But I talk a lot to my patients about kind of what their lifestyle is. Who are they having sex with? Is that an understanding partner? Some people don't masturbate, and I want them to masturbate because I actually feel like that's going to actually help exercise the muscle, because if you don't use it, you lose it. I mean, Absolutely. Women can go their whole life. If they haven't had sex for a while, they don't even think about it. Men cannot. That is not how men are made. Listen, again, I have 2 19-year-olds and a 17-year-old at home. Men are not made the same as women, right? And it's the same thing with the P shot. I want to know that it's working. If they're not having morning wood once in a while, or it doesn't work with Viagra or Cialis, I'm not going to be the magic that takes their 65-year-old PRP and all of a sudden makes their penis like a 20-year-old. So setting expectations during that consultation is imperative. And I hope I'm answering your question. If I go back to your question of just how that consultation works.
So they come in, you do like a questionnaire, like an assessment kind of thing, kind of similar to what we do in our hormone consult. That's actually like included in that. So we can kind of like dig a little deeper. And then how do you decide? Well, let me ask you this. Is there any person who is not a candidate for the P shot or the O shot?
Absolutely. And I think people always ask me, well, what's your success rate? And I very happily say, well, it's in the 90s. I'll tell you that. But why? Because I turn a lot of people away. So I think it's really important to choose your patient wisely. I had a gay lesbian couple come in, and one of the partners was unable to have an orgasm and has never had an orgasm. So they sought me out for some guidance as to, can I do an O shot and then she's going to have an orgasm? No, bye. That's not, I don't have magic, right? Another patient very similar to that wanted to have a vaginal orgasm because, she's watched porn and all these people can do this. And I'm saying to her, okay, stop with the porn, because the percentage of women that can have a vaginal orgasm is extraordinarily low. So your other parts are working great. Now, can I make the G-spot more sensitive by adding PRP? Absolutely. So see how I use different terminology. I can help more. I don't say fix. And it's the same thing we do with every single thing we do in aesthetics, right? We don't promise the world.
Right.
So I do turn a lot of people away. And for men, it's the same thing. Status post prostatectomy with zero function are not going to do well with a P shot. Patients who are coming in for enlargement of their penis, I often say, look, if you have money to throw away, and it's about $2,000. If you have $2,000 to throw away and you want to give it a go, I'm here for you. But I'm not promising anything. And you could throw your money away, because I can't help with their subjective evaluation of how big they want to be. And what I can say is it'll be firmer and better and a better quality erection, but I'm not going to make you a porn star now.
Yeah. No, I think you hit hit the nail right on the head as far as, who is not a candidate. So let's talk through kind of like the OSHOT process. So you come in, you do a consult, like you've got it down, like, with your medical assistant, like everyone's involved. So like patient comes in, you've done your consult, we're green lights to go. Talk through kind of what that process looks like.
So it's really simple. I've already done my full evaluation on the patient. They come in, I ask them to use the restroom first. They undress from the waist down to make them very comfortable. I put numbing cream both on the clitoris, and I insert my finger up into the urethral area and apply numbing cream. They sit for about 20 minutes watching Netflix and chilling while they have their numbing cream on. I draw their blood during that time. I do a double spin method and isolate their platelets. So the procedure itself takes about 5 minutes. The prep takes about 30. And then I inject in 2 places, depending what this is the true OSHOT versus my little adjustments. The 2 injections are one in the clitoris. So before I inject in the clitoris, they're so numb, nobody feels anything. I put a small ice cube on the area I'm injecting, and then I'll put a little lidocaine in, and they don't feel any of that. And then I'll inject the PRP. And then the other injection is right under the urethra. So it supports the urethra and supports the bladder neck, which will help with all of the above. The lubrication will help with atrophy, will also help with stress incontinence. And that's it. They can have sex that night if they want. I usually tell them not to, only because they're a little numb.
Swollen. Yeah, they're
a little uncomfortable.
Mm-hmm.
But there's no downtime. I always say to women, we go through life and we don't think about our vagina every day, all day, unless we have a yeast infection. That's the only time we're thinking about our vagina. And after an OSHOT, sometimes you're thinking about your vagina more.
Yes. Yeah, no, that's perfect. So then aftercare, just kind of lay low that day. Next day, you're back to your normal routine. A patient kind of described it to me because I was like, okay, how'd it go? And she goes, it was fine. Like I didn't have any pain. It just kind of felt like I had a lot of sex the day before because they had a little bit more swelling. And she goes, right. But it was manageable. In fact, I sent her home with like the vagina, like the lips that you use for like lips. I'm like, just put it on the lips downstairs. And so she was like, cool with that plan. But yeah, so that's kind of the feedback I've had with that. Let's talk a little bit about, so in the class that I took with you, and I really, really like this because I've started using it, is if they've ever had a tear or like a little episiotomy, so we do it for scar regeneration. So like you're down there anyway, you got your headlamp on, might as well like inject that too. So as far as like, what would you say, or how would you describe to a patient? Because the way I describe it to a patient is, you've got scar tissue. When you've got scar tissue, muscles can't contract as good as maybe they could. So maybe improving the strength of your orgasm. I mean, is there anything that you would like add to that, or like why we would do that?
So most people don't know where their pain is normally, but it is absolutely what you're saying. It's usually from the episiotomy. The tear does interrupt not only the skin, but the muscle. And keep in mind, PRP will regenerate all things, right? Mm-hmm. Bone, not that there's bone there, but we know bone, nerves, muscle, fat, skin. So it's the magic potion. So we want to definitely put some there as well. So I just gave you kind of the 2 most common areas I'll treat. But in the patient who's got dryness as an issue, or vulvar atrophy, where the vulva are looking like deflated balloons as they age, I'll do PRP in those areas as well. So I'll draw a little extra blood at the time of blood draw, get a little more platelets, and then I'll enhance both the vulva and do lateral injections in the vagina proper, just to give a little bit more PRP.
Yes. And then as far as like onset, so when people ask me like, well, how soon am I going to like notice this? And I'm like, well, everyone's kind of different, but their progress is going to build over time. Do you like it? Because you've done tons. Is there like around this time is typically the feedback as far as like the peak as far as results?
Yeah, so that's a great question, because what I do is from the consult and the sexual wellness survey that I get initially, I have them repeat that at home. So we'll just send them the questionnaire. They'll do it at home, and then they'll send it into my front desk, and I do a phone conversation with them, follow up at 6 weeks. So a lot of my patients aren't even local. So I don't want them to drive back to get somebody just drove 3 hours from Maine to get a no shot. So we'll just do a call at 6 weeks. And we all know that it can take up to 90 days to see full results from anything in terms of collagenesis. So at that 6 weeks, we're midway. I'd say about 90% of my patients are already seeing benefits. In those little slow responders, as I call them, those patients, I'll do another six week phone follow-up. So I can just check in with them, but it can take up to a total of 3 months. The funny thing I've noticed is that the stress incontinence seems almost immediate. And I wonder if that's just from the volume, because it doesn't make sense in my scientific mind that it's because of the PRP. But we put quite a bit of volume right under the urethra. So I wonder if that just starts supporting the urethra for some time, because they do see that quickly.
Yeah. And for the male patients on the P shot, would you say it's about 90 days as well? Six weeks, 90 days?
I do exactly the same thing for the P shots in men.
Okay.
We didn't really talk about the vacuum pump yet, but I have them pump at home for 6 weeks, and I check in with them at 6 weeks, and they fill out their survey. And again, the majority of them at 6 weeks will see their benefits. And I don't need to keep following up, but I just let them know, okay, 6 more weeks, you're still going to see some more. Enjoy, and we'll see you next year. And I do recommend an annual injection.
Right. So that's going to be my next question. So like I tell patients kind of like a once a year type procedure kind of thing. Let's kind of turn the corner now and let's talk a little bit about the wing lift. Just because I was very surprised how popular that was. And I was like, well, let's do it. So talk about what the wing lift is and why we would consider doing that on a patient.
Yeah. So I have, you saw the before and after I like to show, which is one of my favorite patients who, a lot of people don't let you take before and afters when it comes to this area. Yeah. And she's like, you should show everyone my vagina. It looks unbelievable. So this is now she's 59, but was 58 at the time, who's a mother of twin girls in college and started dating. And she's like, my vagina does not look like it looked 20 years ago. It is not just her vagina. She had a C-section for her twins, but the atrophy and kind of like that it does look like a deflated balloon. And I think it also, this is my own theory, that with more Brazilian waxes, we see our vulva more, right? Like people had hair down there when I was initially training as an OB a gazillion years ago. And so they didn't see everything. Now people see everything, the skin color and the texture. Nobody cared. They had just hair. But what's happening is the vulva do really deflate. And the best way to treat that, I do a combination of filler. I like to use Restylane Lift and PRP. And I inject into the vulva with a cannula because there's lots of blood vessels there. We don't need a expanding hematoma. And they love it. They absolutely love it. It's a phenomenal, it plumps them up. They feel great. And you can even do Mons. The Mons gets a little deflated. So it's a great.
It is.
Great.
I've been pleasantly shocked at how many people opt for the wing lift. And then like the feedback I get, like I had a patient who sent me a portal message and she's like, hey, just want you to know, my husband said A+ work down there. And I was like, great. That's awesome. A little Restylane Lift to lift up the wings. Like I told my Galderma rep about what I was doing. And she goes, Lex, I feel like if anyone can make vagina wings fly, it's going to be you. And I was like, no pun intended. But yeah, I feel like that's definitely right up our alley because we do the hormones and all that stuff. So it is. I absolutely love that. And when we learned about it, I'm like, of course, Dr. Lieman's doing this. And of course, like, it's amazing. So that's good.
You can also do smooth threads. You could do lifting threads. I think they'll be a little uncomfortable. And now that I just mentioned that, I want to add one thing. People are so scared of the idea that needles are going in their vagina. Now the clitoris is sensitive, which is why I do the lidocaine and the ice trick. But what I'll say is the vagina is not that sensitive. 9-pound babies come out of there.
Right.
Right. It really can tolerate a lot. So, you want to put your patients at ease and make sure they know, like, this is actually pretty, I always say it's a pain scale of 2 out of 10.
Yeah. Yeah. I've had patients sit up where they signed up for this O shot. I'm like, oh God, you'd be the last patient I'd be wanting to do this on, because I do their sculpture on their face and they're like, ooh, ah. They're like, that wasn't so bad. I'm like, wow, look at that. So that's pretty good. It's pretty good. Let's talk a little bit about, because this is what I love about your GYN background. So you do some devices as well. I know we've been playing text back for like, okay, what are you going to do? Okay, this is what, what's going on. Let's talk a little bit about the device that you use, and you can say the name. There's no like restrictions here. It's free market. Say the device you use, maybe a little bit about the technology behind it and kind of why we would consider doing that.
Yeah, so this is a tough one for me, as Lexi, you know all so well, is I fell in love with a device many years ago that's called the Vive, which is no longer on the market.
Right.
And because everyone knows what I do, they all contact me to buy their tips because the tips are a few $100s. And they were like, I'll give it to you for half price because otherwise they're garbage. And of course, I was like, give me all your tips. So here is where I stand with my device. And I'll tell you a little bit about what it is, but I will use this until it breaks because it's a one-time treatment. It is so comfortable. It's very easy to use. There's no pain. And anybody that gets a one-time treatment and sees results for 2 years is much more willing to do that treatment versus all the other devices on the market are 3-time treatments.
Right.
So what will I buy next? I'm kind of leaning towards the Thermiva. I know I'm going to need something. I like the company. And, if you've been in this business a long time, like myself, sometimes you really have to think about the company in addition to the device. And there's been a lot of companies that I have tried to work with and not love the company itself or the support. And that's how these machines are hundreds of thousands of dollars. So I'm not going to buy, a machine where I have no support or they're difficult to communicate with. And I always end up teaching or being a KOL for the company, usually if it is a GYN related. So I want to see about the partnership. So I'm leaning towards that. I've already talked to them about that, but that is a device. It's also radio frequency, but it's used 3 times, once a month. And so let's say, okay, it's February, you get your procedure done in February, March, April, and then you wait 3 months to see your results. So that now you're talking 6 months to wait for your results. Whereas the Vive is, you do your treatment and within 3 months you see your results. So that's been my challenge with this. I think that's kind of where I sit with it. There is another device on the market that does contractions of the musculature, and it is the Emsella. Are you good?
Yeah, sorry.
No, it's okay.
Question at the door. You said the Emsella, is that the chair?
And that's a chair that you can sit on that helps kind of high intensity muscle contraction, which will help with stress incontinence. And you'll see a little improvement in urge incontinence. And just to define that for those that aren't clinical, stress is really that jumping, coughing, sneezing, leakage, where urge is, the commercial, gotta go right now is like, you have to go, but you can't make it to the bathroom. And a lot of people have mixed incontinence, which is a little bit of each. But with those patients who have mixed incontinence, if the stress is a little bit more, it's worth treating it anyway, because they're going to have improvement overall.
Yes. No, absolutely. And then with the devices in particular, and again, you've really have seen great results with kind of, what you've already had. Is there any condition in particular? Because we talked a little bit about lichens in the lichen sclerosis in the past. Is there any conditions that you can think of that you wouldn't use your device on that you can think of?
No, I mean, a lot of people have IUDs, and that's totally safe and fine. We can totally use that with, it depends on the device. If they have certain metal implants, and that's something that the company will help, depending on what device you're utilizing, give you some guidance. In terms of other things that you can utilize, we didn't mention exosomes, which is really nice topically as well. And there's been a few studies with exosomes and lichen sclerosis that are coming out that look really promising. PRP works fantastically for lichen sclerosis. And lichen sclerosis, I don't see it very much now in the aesthetic industry, but when I was in the GYN world, it would be at least weekly, I'd see a few patients. It's very painful, very uncomfortable. They can't even wear jeans sometimes because of just the discomfort. And it does have a certain appearance to the labia. It's very pale and white. But patients will come to you and they don't even know they have it. They might come to you saying they have, and this is why it's important. I'm not plugging my own class. I could plug anybody. But the truth is, if you're not trained adequately and you don't know what something looks like that's normal or not normal, female circumcision. If you've never seen that, you're not going to know what anatomy you're looking at. Yeah. So it is really important to be trained by somebody that can give you some guidance as to not only where the urethra is and whatnot, but truly what some of these issues that will come to you, because they might just come complaining of pain and not even understand what's going on. And you treat lichen very differently than we don't just do an O shot. We do multiple treatments over time. You need to know how to get them off their steroids, et cetera. Or you need to see it and realize you're not going to treat it if you're uncomfortable and send it to someone else.
Sure. No, absolutely. Well, I think I'm looking at my notes here. I think we've covered everything that I wanted to cover. My last question is, what are your top 3 tips for individuals looking to improve their sexual wellness?
Oh, see, I should have read my questions because I would have thought of that. I'm off the cuff. Number 1, for women, and they're different for men and women. So for women, if you don't use it, you will lose it.
I like that.
So, and it's true. We have all been there. If you haven't been sexual either by yourself or with a partner, then you don't think about it. It just isn't part of forefront of mind. So that would be number 1. Number 2, to realize it's okay to want to improve that part of your life. And then number 3, and I think that this is the hardest thing to grasp, realizing that sex kind of decreasing over time, your enjoyment of it decreasing over time, leaking on yourself is not normal. It's common, but it's not normal. A man would never, ever, ever deal with leaking on himself when he coughed, jumped, or sneezed. He would think that was pathological and something wasn't right. So what I would say is, yes, it's common, but do we have to actually call that normal?
That's good. No, you're absolutely right. Absolutely right. So, Dr. Lieman, where can people, if they want to train on the O shot, where can they find you? Give me all the socials, the handles, the websites, so people can.
So our website is myelitemedspa.com, and our academy is on there, and all of the things are on there. My personal / professional Instagram, and I answer my DM, so you feel free to reach out, is at Dr. Joelle Lieman. Our med spa is at My Elite Med Spa, and our academy is at my.elite academy.
Perfect. I'll be sure to link them all in the show notes and tags and all those good things. But that way people know if they're like, hey, where do I train with her? I'm like, go find her. All right.
We usually do our trainings just so if anyone is interested, they're really, what you did is not typical. I like to do them very, very small. I know we did it at Aesthetic Next and we kind of opened it up to everyone. I like to do a very small training. It's very intensive. It's a full 8 hours. There are 5 models. We do PRP for hair, face, breast, and vagina and penis. So it's a very intensive day. And I do like no more than four students so that everyone gets a chance to get their hands dirty.
Perfect. Well, thank you so much for taking the time out of your very busy schedule to come enlighten us and share your amazing experience. Like I said, I've been wanting to get you on the podcast for a while. After I got a couple O shots under my belt, I'm like, then I kind of know what questions to ask because, I've been in there, done the things. I hope to have you on again, probably talking about some other good sexual wellness type stuff, but I'm sure we'll have you on again.
You know what I want to say, Lexi, that's so interesting is yesterday I was going through my emails and you have all that garbage email from everyone trying to sell you something on Valentine's Day. Brookstone had vibrators.
Oh my God.
That was their ad for Valentine's Day. If you do not realize, whoever is listening, if you do not realize that sexual wellness is part of the world now, and in mainstay, go to CVS everywhere. There are vibrators everywhere.
Yeah. They started carrying all kinds of vibrators.
I love that you're bringing awareness. I think it's hugely important. And I thank you so, so much. And I just adore you.
Well, thank you so much.